Hello, I'm Leslie Craig, the Public Health Advisor for the U.S. Department of Health and Human Services in the Region 5 Office of the Assistant Secretary for Health. Region 5 covers the 6 states of Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. On behalf of my office and my partners, the University of Minnesota State Adolescent Health Resource Center, Wisconsin Department of Public Instruction, and the Wisconsin Department of Health Services, thank you all for joining us for today's webinar, Supporting Student Mental Health, Wisconsin's Approach to Trauma-Sensitive Schools. We know that trauma experienced by children and youth is a pervasive and serious public health issue. Trauma during childhood is associated with a range of physical health and emotional problems, including suicide, and among youth ages 10 to 24, suicide is the second leading cause of death. Additionally, data from the Adverse Childhood Experiences, or ACE study, found that certain traumatic experiences that occur during childhood can have serious health and social consequences into adulthood. A coordinated response is needed to address the mental, emotional, and physical health needs of children, youth, and young adults who have experienced trauma. You can learn more about Adverse Childhood Experiences, or ACEs, through the Center for Disease Control and Prevention's violence prevention resources, such as their ACEs overview information here, as well as this Veto Violence webpage, which is focused on prevention of adverse childhood experiences. Additionally, each year on May 10th, the HHS Substance Abuse and Mental Health Services Administration, SAMHSA, hosts Children's Mental Health Awareness Day. This year's 2018 Awareness Day theme was Partnering for Health and Hope Following Trauma. The website includes information to better understanding the impact of trauma on young people and has several resources to address the issue. Today's webinar highlights the trauma-sensitive schools movement happening in Wisconsin. It will describe how the Wisconsin Department of Public Instruction has used implementation science to strategically and thoughtfully support schools across the state to become trauma-sensitive to prevent and mitigate the impacts of traumatic exposure on youth. Before we begin, I'd like to draw your attention to some important webinar logistics. Today's webinar is being recorded and you are currently in a listen-only mode. Please use the chat box to submit any questions throughout the session, and we will designate time at the end of the webinar to answer as many of your questions as time allows. Additionally, our webinar host, the University of Minnesota State Adolescent Health Resource Center, will distribute an evaluation following the session. In the next week, a recording of the webinar will be emailed out. A little bit of background about my office. In early 2016, we established the Region 5 Adolescent Health Network. The regional network addresses a myriad of adolescent health issues, and we've designed this year's 2018 programming to focus on topics related to mental health and well-being. So this slide includes details on how you can sign up for our email listserv to receive updates. I would also like to acknowledge our sister agency, the Office of Adolescent Health's national call to action, Adolescent Health Think, Act, Grow, or TAG. This call to action aims to raise awareness about the importance of adolescent health, engage stakeholders, get adolescent health on the national agenda, and spur action through a comprehensive, strengths-based approach. You can learn more about the Office of Adolescent Health and TAG by visiting their website and signing up for their e-updates. Now, before I hand it over, a quick disclaimer. Please know the content and views contained in these presentations do not necessarily represent the official policies of the Office of the Assistant Secretary for Health or the U.S. Department of Health and Human Services. I'd like to thank each of you, our participants here in Region 5 and across the country, for joining us for today's webinar. We will have brief introductory remarks from our partners, Kristen Teipel, Director of the State Adolescent Health Resource Center at the University of Minnesota, Mariah Geiger, Public Health Educator in the Adolescent Health Section of the Wisconsin Department of Health Services, followed by a comprehensive presentation of Wisconsin's trauma-sensitive schools work from Elizabeth Cook, School Psychology Consultant at the Wisconsin Department of Public Instruction. Kristen.
Thanks, Leslie. So I just wanted to continue your offering of resources, tell you a little bit about our center. I work at the State Adolescent Health Resource Center housed at the University of Minnesota, as Leslie mentioned, and we are part of a larger national initiative that might be of interest to those of you who are looking to support students and young people and families as they experience and address trauma in their lives and mental health and emotional support issues. So as you look to partner within and outside of schools with the health world, our Adolescent and Young Adult Health National Resource Center is a resource for you. We support state health departments across the country as they take on the health and healthcare issues of young people and their families. So just keep us in mind if you're looking for some supports. I'm going to pass this on to Mariah and let you take it from here, Mariah.
Thank you. Good morning, everyone. As Leslie mentioned, I'm here from the Adolescent Health Program at the Wisconsin Department of Health Services, and we're so excited to have so many impactful projects going on in our state and across the country that affects the well-being of adolescents. I have graciously been given some time to highlight the resources that the Department of Health Services has available. If you're interested in information and resources from our Adolescent Health Program, please check out our Adolescent Health webpage. It is referenced on this slide, and there's a link in there. It is a great place to see the latest resources that we've created, including one that I'm very excited about, the Youth Engagement Toolkit. This toolkit provides a guide for engaging youth as leaders in programs that affect them. It combines some of my favorite existing tools and adds new ideas to the conversation. It was also written with people carrying out local adolescent health programs specifically in mind. We've also got quick data briefs, information on the well visit, and you can sign up for our email list on the sidebar of the web page to receive our newest resources right when they come out. So thank you so much for your time today, and please be sure to check out our resources if those apply to what you're interested in.
So Elizabeth, we'll turn this over to you now, and there you go.
Good, thank you. Well, thanks everybody. I'm really excited to talk with you today. As was said earlier, my name is Elizabeth Cook. I am the school psychology consultant at the Wisconsin Department of Public Instruction, and among several initiatives that I take the lead on at the agency, one of them is our approach to trauma-sensitive schools. So I'm really excited today to present with you and to you about what we've been doing, and then hear your questions and hopefully have a little conversation around what's working. So what we're going to do today, just to orient you, is I'm going to give you just a bit of background about who we are at the agency and how did we get to the place where we're at right now, where I'm presenting to you. And then we'll talk a little bit about the Trauma Sensitive Schools Initiative. What is it? How are we implementing it? And we'll talk a little bit about what's working about it. We're not going to get in deep on implementation barriers, but we know that they exist, so I wanted to give you some information there. And then we'll have some time for Q&A. So this is going to be a really quick overview. So please come with good questions because there will be time at the end for that. So I always like to preface when I'm talking about our work around this being a journey. This is really a journey for our schools. It's a journey for our agency as well. And so really what I want to share with you today is our story and the story of our schools as we've been moving forward in this work. So who are we in the state of Wisconsin? We have about 860,000 students. We've got 446 districts. We're mostly white and mostly non-economically disadvantaged. The interesting thing about Wisconsin is that our 5 largest districts educate roughly about 20% of all Wisconsin students. And so it's kind of an interesting thing to think about. We talk about the Big 5 a lot, and we'll talk a little bit about adverse childhood experiences across the state and all counties, regardless of whether you're sitting in one of the 5 largest districts or not. So we have a mission and vision at the agency, as most agencies do. Like most state education agencies, our vision is around students being graduated, college, and career ready. What makes us unique is the vision around the mission. And so our vision comes alive with these 4 pillars. And the one that I want to focus mostly on today is that one that's in the upper left-hand corner, keeping our kids healthy, safe, supported, and encouraged in school every day. And underneath that, we've got kind of some sub-actionable items to really talk about, well, what do we mean, right? It's great to say we want kids to be healthy and safe and supportive, and we're supporting the whole child, and that all sounds really good. But from a real practical perspective, what do we mean at the agency when we say that? And the primary point of focus that I work on is that first bullet point, so around growing mental health supports for kids across all parts of the state. And then enhancing our school safety measures that address bullying, racism, and harassment, and then supporting and expanding community learning centers, and making sure that everyone has equitable access to summer learning opportunities. So I work for a team called Student Services Prevention and Wellness. We house consultants. We're very fortunate in the state. We have consultants for all 4 student services professionals. So school psychology, school counseling, school nursing, and school social work all have their own individual consultants to the field. We also host a slew of educational consultants that work on all things related to wellness and mental health in the agency. So things from staff wellness and self-care, bullying, school safety, suicide prevention, LGBTQ issues. We also house the YRBS on our team in terms of the data collection and analysis of that as well. And so what we're really talking about on our team is what we call the Wisconsin School Mental Health Framework. It's an actual framework that we have a document for. And it's hard to see on this slide, but it's in that multi-tiered system of support process, so that idea of supporting all kids, and then for kids that are struggling, providing them the additional resources that they need. And what you can't really see on this slide, but it's important for me to let you know, is that we consider trauma-sensitive schools or trauma-informed practices a universal practice. And we can talk a little bit about what we do for kids that are showing significant impacts and how we do trauma-informed interventions at the Tier 2 and Tier 3 level. But for the purposes of today, we're going to be focusing on trauma-sensitive schools as a universal. So a quick timeline for trauma-sensitive schools in Wisconsin. We've been doing this work in some way, shape, or form for a while. As a state, broadly speaking, DPI is actually a little bit late on the game in terms of interacting with trauma-informed care. DHS and other state agencies have been doing this for longer than us. But we developed a cross-system work group in 2010 that was meant to bring in multiple service agencies together to talk about these things. We started bringing in speakers at conferences to talk about trauma-informed care, and then we developed a toolkit in 2011. And so that was going okay. And then what ended up happening was with that suite of Now is the Time grant funding that came from the federal government, the agency applied for a Project Aware grant out of SAMHSA and a School Climate Transformation grant out of the Department of Education. And in 2015, we launched what we call the Trauma Sensitive Schools Initiative. We are now in our 4th iteration of that, so we've been running 4 cohorts every year for the last 4 years, and that's primarily what I'm going to present to you today. So what does that mean when I talk about these cohorts of schools? To date, we have 252 schools across the state that are engaging with us on a multi-year initiative to infuse trauma-informed practices into everything that they do. As we talk through it, you'll see that we don't consider this a set of strategies or a new framework, that this really is a lens by which people do business, and our primary goal through our multi-year process is to teach folks how to implement trauma-informed care practices and how to use the lens to evaluate everything they do within the system. And as you can see, we're spread all across the state. That's really important to us, that as we select our cohorts every year, that we're being really mindful of making sure that we have representation from across the state in rural, urban, and suburban settings, so that as we're connecting schools with each other, people have friends and neighbors that they can interact with kind of within their region, but also so that they can learn from other schools who may have similar demographics but maybe on the other side of the state. So in a nutshell, what do we mean when we talk about trauma-sensitive schools? A couple of months ago, I was on a plane to Vegas to present at the Center for School Mental Health Conference, and I was reading Brene Brown's Daring to Lead. It had just come out. I literally got it the day that I left for Vegas. And she has this really great quote in it that's really been orienting to me in the last couple of months, and I wanted to share it with you because I feel like this is what it is to talk about trauma-sensitive schools, but adolescent health or mental health broadly or wellness for folks when you talk about schools. And it's this idea that what you're ethically called to do is create a space in schools and classrooms where all students can walk in and for that day or hour, take off the crushing weight of their armor, hang it on a rack, and open their heart to truly being seen. And that's really our primary goal with trauma-sensitive schools, is to really see kids for who they are and what their potential is and what they're capable of doing, as opposed to what they may be presenting in front of us. But we do have a technical definition, even though I would prefer now just to replace our technical definition with that one and call it a day. But this is a definition that we created a few years ago after we've been doing this for a while and decided that we needed a definition. And like I said earlier, we consider this an innovation. It's really a lens in which schools infuse the core values of safety, trust, choice, collaboration, and empowerment into all of their system of practices, right? So your assessments, your program adjustments, what you're doing. Important in our definition is an acknowledgement that adversity in the state is extremely high, and that staff wellness and that parallel process between building resiliency in kids at the same time we're building resiliency in our educators is extraordinarily important. So just a quick overview. I won't go into this too much, but these are the prevalence of ACEs in Wisconsin. Relatively similar to the national numbers, but as you can see, like our definition says, ACEs are prevalent in the state of Wisconsin. And then interestingly, we also have the ability to look at county level data. And so you can see here that across the state, we've got varying levels of exposure to adversity across the state. And we use this slide when we're talking across all settings to really impress with folks the fact that adversity in childhood aren't things that just happen in urban settings, right? This isn't just a thing that happens in Milwaukee or in Madison, that these are things that happen pervasively across the state. And that really helps, especially for some of our districts that may be a little bit resistant to engaging in the movement or don't feel like this impacts them or we don't have adversity in our backyard. So this becomes my favorite slide, which is, as you're probably all familiar with, this is kind of ACEs across the lifespan. This is the public health perspective of it, right? That you get this historic generational trauma, leading into adversity, which disrupts your neurodevelopment, which causes social, emotional, cognitive issues, which then increases the probability that you're going to adopt high risk or unhealthy behaviors, which then leads to disease, which then leads to death, right? And then you die prematurely, which is not good. We don't want that to happen. But part of why this is so important to us as an agency and why we prioritize it so much is that as an educator, our sphere of influence is really around that social, emotional, and cognitive development of students. When I'm in front of educators, we really talk about how they are brain builders, right? When you teach anybody a new thing, you're either building a new neural connection or you're reinforcing an existing neural connection, and you have this great ability to disrupt, right, some of the neurological issues that can happen when you're exposed to adversity. And so to me, it's really empowering for educators, all educators. It doesn't matter to me if you're a student service provider or a classroom teacher, a special education teacher, or an aide, or a food service worker, or a bus driver. Everybody has the capacity to build good neurology in the students that they're interacting with and be a protective factor in the lives of students. So because of that, this is why we take a whole school approach. The primary reasons that we do that is because it's efficient and effective. We talk a lot about how although we know the prevalence of adversity in childhood is common, the impact is not always as obvious, particularly for our folks that have more internalizing concerns, so people who are maybe feeling more withdrawn or anxious or having dissociative responses. They're harder to catch than students who are more externalizing and more acting out, and so this kind of helps to guarantee more support for more students. That it's proactive rather than reactive. So for students who aren't feeling impact from adversity or don't have exposure to adversity in their childhood, it builds resiliency for those kids. And as it turns out, it builds resiliency for the kids who are impacted by adversity. And that it's always linked back to the school culture and expectations. When you talk about resiliency, that cohesion within your system is so important, right? That people feel connected and that they belong. And so we really talk about this as a way for kids to be seen, to promote that resiliency building factor of cohesion. And then finally, empowers everybody. Like I said in the previous slide, this is not a thing that lives in student services. This is not a thing that lives in community-based mental health providers that might be in your school. This is really about all the adults in the building are able to be an important person and build a relationship with a student within their system. But like I said at the beginning, this is a journey. We try to root ourselves as much as possible in the science of implementation. If you're not familiar with the National Implementation Research Network, also known as NERN, and you're a person who engages in any kind of initiative, it doesn't really matter what the initiative is, I highly recommend checking out their resources. They're doing a lot of work in terms of how do you do work and how do you do it well. And what we try to kind of emphasize to our schools is this quote from NERN, right? That no matter how much you know or think you know, children and families cannot benefit from interventions that they don't receive, which seems really self-evident when you say it out loud, but this happens a lot, particularly in the school setting, right? Where we'll talk about an innovation or a curriculum or an intervention or a strategy, and then we don't put it in play in a way that it has fidelity, or maybe it's a little bit haphazard, and so it never really accesses the students in the way that we want to. And so someone cannot benefit from something that they don't have access to. And so the 4 stages of implementation are exploration, installation, initial implementation, and full implementation. And in our experience, schools in general do a pretty decent job with exploring. We try to get schools to slow down. We do a lot of go slow to go fast, but exploration is that idea of I think that I need a thing, and I found a thing that I think might fit that need, and now I'm going to sit and actually intentionally with my team think about whether or not that's accurate, right? Do I need it, and how do I know that I need it? And can I do it, and how do I know that I can do it, right? So it's an intentional process there. Educators have a tendency, and I don't think this is unique to education, but they have a tendency to skip installation. And installation is really setting the conditions of your environment to increase the probability that whatever you're going to do is actually going to work, right? And so if you find a curriculum or a set of strategies in the beginning of August, and then you tell your teachers, okay, now go forth and do on September 3rd, when school starts and the kids are there, and you don't give any room or space to actually set the conditions so that could work, what we know is that initiatives don't sustain as well, right? And that people tend to get burned out about that. And then when people get burned out, what they do is they tend to blame the initiative as opposed to the implementation aspects of the initiative. So a lot of what we focus on, especially in our first year of our project, is meaningful installation. So how does your team go slow to go fast so that you can increase the probability that this is not going to be just another thing that people are juggling. And part of how we message that is talking about trauma awareness or trauma-informed care as a spectrum of knowledge to practice, right? That starts with an awareness and then eventually leads into being a trauma-sensitive school. And so what we talk about with folks is this idea that the first step is just becoming aware, right? Aware that adversity in childhood is prevalent, that toxic stress is highly impactful on people in general, not just students, but adults as well. And that within your school community, you probably have students who have experienced a lot of this and families that have experienced a lot of this, right? And then here's some strategies, right? And that kind of moves into like, okay, now I understand this. I'm going to change my way of responding to students. But that response process becomes a little bit haphazard, right? So I'm going to do it with this student on this particular day, but I haven't quite shifted my perspective on this student, so it's not going to land in the same way. Or today I'm really gassed in tax, and so I don't have the resources to put my cognitive effort into the trauma responsive pieces of it. And then eventually what happens is that repetition builds fluency, right? And so you do that more and more to the point where it just becomes how you do business, right? It's like that whole idea of efficient neural pathways, neurons that fire together, wire together, and after a while it becomes this smooth process. And part of what we emphasize is that that is a natural part of learning any new skill. And this is really a new skill set, a new orientation, a new way of thinking about things. I always like to make it akin to running. I am not a runner myself, but there are always at least some person in the audience that is a runner, you know, and you don't wake up one day and say, you know what I'm going to do? I'm going to like run a marathon, or I'm going to do an Ironman. Like I'm just like feel like exercising all day. And then you go and you do it and you're good at it, right? It's this idea that the first step is to build awareness, right? Of that's the thing that you want to do, thinking about what the equipment that you would need in order to make that happen, right? And then you have a training plan. And some days you're really on it, right? Your runs go really well and you're excited about it, but then other days maybe you don't want to, and so you don't go that day, or you have a bad run or whatever else. And then eventually, as I understand it from people who are runners, right, that you do that enough that being a runner just becomes who you are, right? And so you can't imagine having a day where that's not part of it. And that's what we really try to emphasize with trauma-sensitive schools, right? Awareness to practice is a process, and it's a little bit of a muddy process, and it can be a really frustrating process. And to allow that to breathe within your systems and allow for that aspect to happen so that people can really practice in a trustworthy environment to build that fluency. So the fundamental strategy that we have, we didn't used to call this a strategy, and then people got mad at us because they wanted strategy, so then I just started calling this a strategy, is this idea of perspective shift, right? That before we do anything, we need to think differently about the students that are in front of us. That I can give someone an evidence-based trauma-informed intervention, right, that has a lot of good data behind it, but if at the end of the day, the person who's giving that intervention fundamentally thinks that a student is choosing to act out or doesn't value being there, or I'm labeling them by their diagnoses maybe, or what I perceive their diagnoses to be, then I'm going to have a blockage in being able to authentically engage in the relationship that needs to happen for that intervention to work, right? That relationship is a prerequisite for good intervention. And so we're a little hesitant to give a checklist of strategies without really talking about the importance of shifting your perspective to the fact that students are just lacking skills, that they're coping the best way they can, and what you're seeing in front of you, right, are not bad behaviors necessarily. They're things that aren't adaptive to the particular context that you're in, which happens to be a school context. But in other contexts, may be highly, highly adaptive, right? If I go home and my parents argue a lot, right, or there's domestic violence in the home, a dissociative response where I'm checking out may be an important adaptive response to me, right? In order to preserve my own self, in order to keep my cortisol levels as down as possible, right, in order to feel safe. The challenge is that then you put that same person in an English classroom, where the teacher's talking to them, and the least dangerous assumption for the brain is to assume that that's a threatful information, that's a threat situation as well, and so then you get the same dissociative response. And so it's not that that person is being lazy, it's that the response just doesn't fit the context, and our job is to teach the brain as much as possible how to contextualize the responses that they're giving. Like I said, staff wellness is also highly critical to this process. In the state of Wisconsin, we call that compassion resiliency. We have a compassion resiliency toolkit that we have developed in coordination with Rogers and Health. And there actually is one for community providers too. So for those of you that are on the call that work more in the community setting, I highly recommend looking at that too. But when we talk about compassion resiliency or staff wellness, we really break it into 4 main areas. Setting expectations, so ones that are realistic for you, but also ones that are realistic for the people who are around you, and sort of practicing forgiveness of folks that maybe aren't meeting expectations that are too high, and forgiving yourself for the same. Boundary setting. My friend and colleague Sue McKenzie has this really great quote that I love. I use it all the time just sort of as a personal mantra, and that's, when you know your yeses, your nos flow with grace. And it's just this idea that I know what I can and want to say yes to within reason, and then I'm going to actually practice doing that so I don't feel as burnt out. Staff culture becomes huge in this, right? Connecting with a culture that's helpful and healing. I can tell an educator to do as much, yoga or mindfulness or get some essential oils or go for runs or whatever that is. But if at the end of the day, the system that they're walking into every day is fundamentally toxic, it doesn't really matter how much of that you can do, right? There's only so much that those individual components can bring in if the culture itself is toxic. And then self-care within those 4 categories: mind, spirit, strength, and heart. So when we talk about trauma-sensitive schools as a universal approach at the universal level, what we really mean is to take those 5 trauma-informed care values and infuse them in these categories. So school environments, social-emotional learning, emotional and physical regulation, building relationship, school-wide discipline, academic supports, cognitive problem-solving, parent engagement, and staff wellness. And how we do that is through our online professional development system. This is a totally free, on-demand, able to be accessed professional development system. It has 3 components to it. There's a learning module for each one of those targets areas that I referenced in the previous slide, as well as we're building out our Tier 2 and Tier 3 modules. So the learning modules are basically narrated PowerPoints that focus on one aspect. Then within those modules, we have supplemental readings, so resources that are meant to expand the knowledge. And then each module has an implementation tool. And the goal of that tool is to take whatever that small concept is from that module and have that ready-made to use in a classroom setting so that a teacher can say, okay, I understand prevalence and impact, and now I'm going to do a classroom walkthrough to see, what is it like to be a student from the time that they get up to the time that they get to my door in the morning, for example. Oh, hold on, there it goes. So what do we do with those? We have a theory of change, which is that we ask folks to develop a team. It doesn't have to be a new team. It can be an existing team where they identify at least two folks that are internal champions, we call them coaches, that are going to really help drive the work and move it forward. And we provide professional development for those folks in trauma-sensitive schools, as well as implementation science and coaching and sustainability. They develop their own professional development plan for the remainder of their staff in terms of what their priorities are and their specific goals, focusing specifically on changing perspective and school culture and school climate, and shifting class-wide and school-wide practices, which then leads to improved student outcomes. So we do have an application process for school selection. It's actually based on readiness rather than perceived need, which when we decided to move that way, it caused a little bit of controversy, and I understand that. But what we find is that if folks aren't ready to implement the initiative, what we know is that it probably won't go well, and then it'll be like that whole, well, we did that trauma-informed care thing that one time, and that didn't work for us, so now we're on to the next thing. And we really want to empower schools to get out of the cycle of initiative fatigue by really being able to think about whether or not they're ready. And so we base it on something called the Hexagon tool, which is an implementation science tool that allows folks to think about readiness from various aspects. And then we have a regional implementation structure. So we have 12 regional service agencies, or CISAs, across the state of Wisconsin, and we represent from each of those. And then each of those regions have an external person that provides technical assistance and coaching within that region. And so for the purposes of cohorts 3 and 4, we have 4 total regions. We do a kickoff event at the beginning of the year where the whole team comes. It's a really, really great time. We teach them about what the project is, we do some action planning, and we set the stage with this slide. And so I share it with you because the first time I presented it to a group of folks, I don't think that they believed me because I work from the state agency and people are used to engaging with us from a compliance perspective. And sort of every year we have more credibility in the fact that there's truth in this. And it's this idea that the whole goal of this project is to be bi-directional in terms of collaboration and responsiveness, that we grow and evolve because we get feedback from the field about what's working and what's not working and can make those adjustments. And that the truth is that there's no one right way to do this, right? There are a couple of ways that we would say that's probably not the route that we would go, but there are a myriad of pathways that are contextual to the specific community that you're in. And so our job is really to provide support and encouragement as those things are happening, but not to dictate what it is that it's supposed to look like. So folks in our project that first year is not, okay, everyone has to do these 7 things and these are what your goals are. It really is contextualized. And like I said, the first year and a half or so, people sort of didn't believe us, but now they're starting to, so I feel good about that. We do a Plan, Do, Study, Act cycle for our Trauma Sensitive Schools project. It's pretty, standard practice profile for engaging in an initiative. The plan part, this is what the project structure looks like. So we have schools select a team. We always encourage the use of an existing team. Nobody needs more meetings. Administration is now required. There was a point where it was required, but it was sort of a soft requirement. That was a lesson learned from us that it's a bad idea to not have an administrator there. So now we require administration. We strongly, strongly encourage general education teacher leaders. And in our application project, you actually get more points if your team includes a general education provider as well as a parent. Because what we're talking about is implementing school-wide and classroom-wide strategies. And so if the primary drivers of the decision-making are administration and student services, then you're missing a voice of people who can actually tell you whether or not this is going to work within the classroom setting. Like I said earlier, there's a selection of 2 internal coaches or Trauma Sensitive Schools champion. They develop an action plan based on a needs assessment that we have. And as I alluded to in the previous slide, the action plans are relevant to the specific context. We don't dictate what those are, although I will tell you common themes come up, and that'll be on the next slide. We do 1 or 2 whole team professional developments every year, and in between those times we do intensive coaching and technical assistance through regional meetings with those TSS champions. And our model is intended to be a reverse professional development model, which means that school teams or those individual folks watch the modules and read the readings on their own, and then when they come together they talk about those and implementation logistics and action planning, so that we're spending those valuable time not necessarily learning or talking at people, but really getting them engaged in how things are working and what supports they may need. So like I said, we don't dictate, but I can tell you over 4 years, these are where teams start. Like 80% of our schools start with staff wellness. We actually added a second day of training this year around staff wellness because it's so prevalent. But professional development, environmental changes, focusing on perspective shift and culture, and then expanding partnerships and team makeups are our kind of most common starting action items. The study and act part comes with our evaluation. So we have an entire evaluation plan. We have our own created Trauma Sensitive Schools Fidelity Checklist. It's available on our website. You can take a look at it. We also use a proprietary survey out of Tulane called the Attitudes Related to Trauma-Informed Care. We do the climate surveys out of the U.S. Department of Ed. And then we at the department are fortunate to have a lot of available data to us that then we can analyze. So we look at staff attention and attendance, academic information, and we'll look at disciplinary outcomes as well, because we track expulsions up at the agency level, and academic information too. So, and then we use year 2 and 3 to make adjustments related to the data. So what the school's data is telling them they need to do, we redevelop the action plans, and then we kind of just continue to plug along. So here's a sample of what the timeline looks like in our projects. So this was this year's timeline. We have a kickoff event in August, action plans and pre-assessments are due in October. Then they have their implementation of their action plans that sort of pervade throughout the year, their regional meetings that they schedule based on region-specific availability. And then we do our post-analysis in May, and then we start over again in August. So what we're looking at in terms of outcomes are changes between reporting periods and a deeper understanding of cross-sectional and baseline results to inform non-project practice and technical assistance. And if you're interested in the evaluation tools that we're using, you can find them at that link. Oh, I don't want to talk about funding yet. In terms of outcome data, we'll be doing our first report at the end of this year. Our first 2 cohorts are done at the end of this year, but our preliminary data is showing that we are seeing statistically significant shifts in people's perspectives. We are seeing students more aware of trauma and the impact of toxic stress, and we are starting to see some shifts in climate. And so that's really exciting to see. So be on the lookout. Probably late this summer, we'll have a report out available on the project. So a lot of people ask where we get the money for this. Like I said before, we have a school climate transformation grant from the Department of Education, which supports module development and the training of the first 3 cohorts, as well as other training and TA. We were just awarded a second round of climate, and through that, we will be doing longitudinal outcome data. So I said that cohorts 1 and 2 are done this year, and we're able to 3 or 4 years from now, at project end of our second climate, go back to them and say, hey, how are you sustaining without any intervention or supports from us? We are also very fortunate in the state of Wisconsin that we have bipartisan support for trauma-sensitive schools. Our current First Lady, Jeanette Walker, is very invested in the trauma-informed care movement. She really wants Wisconsin to be the first trauma-informed care state in the nation. And so in the last biennial budget, the 17-19 budget, we had $120,000 specifically allocated for trauma-sensitive schools. And although it's not millions, right, we're able to supplement a lot of our federal funding now with ongoing coaching and TA and content development and working on our scaling up process with money that's specifically allocated in the state budget. So that feels really good that we're a little bit less soft in terms of our funding. So real quick, and then we'll move on to questions. We'll talk a little bit about sustainability. Like I said, we're not going to get into this, but every year we collect barriers, and the top barriers, I know it says 4, but there's actually 5 there, so counting apparently was not my strength when I made this slide. But the top barriers are time, who's on your team, how do you change perspective, how do you integrate with the other million things that you have going on as a school system, and then how do you sustain? And then kind of within that, then there are these other barriers that come up, like fostering buy-in or staff turnover, which in education, staff turnover tends to be relatively high. We also have shortages, too, in a variety of important fields. So again, how do you keep this going in terms of sustainability? And what's our role in terms of what's next? Well, the budget cycle is ready to be looked at again. And so the Department of Public Instruction has some specific asks around funding and school mental health, around more pupil services staff, and then increasing the funding on the training that we had before. So $64 million to increase mental health funding, which would include an increase in trauma-informed care, trauma-sensitive schools. So we're pretty excited about that as a potential possibility. And then, like I said, we got that $120,000 that's in the state biennial budget, and our goal is to use that to support statewide scale-up. And so we are working on an infrastructure where the Department of Public Instruction would kind of remove itself from organizing some of the kickoff events and all of those pieces, and we would delegate that responsibility to my team. Has a training arm called the Wisconsin Safe and Healthy School Center, who would provide in support of trainer of trainers and provide ongoing TA to our regional service agencies, that our regional service agencies would take on that regional coordination in terms of that external TA and coaching to our LEAs. Because what I know is that we take, I don't know, it's supposed to be 30, but this year was like 42 schools a year. And when you have 420 some districts, it's just not sustainable for us to be able to do that and get the widespread initiative out there in the way that I think that we not only want, but that the students deserve. And so we're going to be moving to this regional space for next school year. So more to come in terms of how that goes. We also focus very heavily on integration. It's one of my other kind of areas of focus at the agency. I do a lot in terms of liaisoning with the Wisconsin PBIS network and really thinking about how social emotional learning, positive behavior intervention supports, compassion resilience, and special education supports, how you infuse a trauma-informed care lens or trauma-sensitive schools lens through that so that you have integrated school community experiences. And so we've been doing some cool things there as well. So the last thing I will leave you with, and then we'll go to questions, is some anecdotal results. Part of our data collection is to interview folks about how things are going. And so you can see here that our folks across the board, you know, whether you're a coach or a counselor or a principal, are really feeling like this initiative is going well for them, that it's worthwhile, and that they're seeing meaningful changes. And so, yes, of course, we want the data to be statistically significant, and we want to be able to have, you know, results that are replicable and publishable and all of that great stuff that matters to move from, you know, evidence-informed to evidence-based. It's highly important. But it's also really impactful just to hear the individual stories that are coming out of our schools and our coaches, and to see the sense of, you know, joy and pride and renewal that they have in doing this work and supporting their students and their families. So that's it. I think we've got about 15 minutes for questions if there are any. And in the meantime, if you're not a person who is into asking questions on webinars and you want to reach out to me via email or via phone, please don't hesitate to do that. We love talking with folks, you know, over at the agency. If you're out of state and you're interested in starting this in your own organization or connecting with other folks, let us know too. We're happy to help support there and share more of our story. So thanks. And with that, I think I have to give the ball back to Kristen, right? I think I did it.
Yes, great. You did perfectly. Thank you.
Thank you.
So if you have questions, please feel free to enter them into the chat box type away your hearts and your souls and your questions. Leslie mentions that someone asked about common barriers, and Elizabeth, do you include discussions on this in your trainings? How do you support individual schools as they experience different barriers?
Yeah, so, you know, the interesting thing about barriers is how we've been running it is that at the mid-year meeting that first year, we just have folks identify common barriers. And then as that second year unfolds, we have them identify, we do a carousel activity and they identify solutions to those barriers, and then we can compile them into a list that then we share with everybody. And part of the reason why we do it that way is that first year, you sort of don't know what you don't know, and people are pretty overwhelmed with a lot of aspects of it. And so we don't spend a lot of time telling them what barriers to anticipate because they haven't experienced them yet. But that second year and third year, we really focus a lot more on barrier pieces. And the ways that we do that are through our regional meetings. And so our coaches will provide either individual technical assistance and supports for schools that need it, or at those regional meetings, they'll talk about, you know, and collaborate on, you know, who's found a solution to professional development time, for example, and what might that look like, and how can we do that same thing in our system.
Great, thanks. We've gotten another question here. For schools outside of Wisconsin that don't have funding to do this work, what would you recommend as the first step in getting started? That's a good question.
Yeah, it's a great question. We actually, our first module on the website is called Getting Started, and it gives you kind of an overview of what to look like. I would say that the first thing that I would do is, you know, pull together a team of folks that are, you know, interested and willing, watch that first module and do we have a needs assessment attached to it. Those are all available for free, and do it and figure out how you can action plan from there. Although money is important and matters in terms of moving initiative forward, a lot of that initial pre-work that you can do, especially around, you know, building awareness and shifting perspective and working on staff wellness, it costs resources in terms of time, but not additional funding necessarily. And so I think part of getting it started is sort of decoupling the idea that in order to do something, I always need to have, you know, some kind of money attached to it. And with those initial stages with trauma-sensitive schools, you really can do without money. Now, resources in terms of FTE you need, so that would be a conversation to have with your team.
Really good points. Really changing just the culture and looking, this is just what you do, as you mentioned earlier, too. We have another question on, do you or do schools offer presentations to parents about the model or about trauma and trauma approaches in general? And if so, do you have a sense of how parents receive this information?
Yeah, so that's a really good question. I'm going to be honest with you. Parent voice and youth voice are a place where we're not very strong right now, and a place that we're trying to increase our strength in terms of how do we make this parent-friendly, even on the website, right, so a parent can sort of meaningfully access it. And same thing with youth voice, which I know wasn't part of the question, but to me that's like another important component that we're very glaringly missing in our approach currently that we're working on. So I would say right now it's not very intentional. We encourage the use of parents on teams and leveraging PTA, leveraging school boards, and we'll talk with our teams about how to engage with those individual stakeholder groups about that, but we don't have any formal process right now for engaging parents, and our schools come up with their creative solutions about how they do that.
That's great. Like you said, it's a journey.
Yeah.
As you go.
You know, and it's like you don't know what you don't know, and you don't realize, like, definition's a great example. Like, we didn't have a definition. We started in 2015. We didn't have a definition until 2017. We're like, oh, I guess we should probably need to define it, what we're talking about. So, you know, you just evolve as it goes along and, you know, forgive yourself for the things that seem really obvious that you didn't do.
Yeah, that's great. All right, here comes another one. Does DPI or schools engage school-based health centers or school health nurses, and do you encourage their inclusion in the planning and the implementation team?
Yeah, so for the purposes of DPI, we consider school nurses part of people services. And so whenever we talk about people services, it's inclusive of school nurses. And so we have a variety of school teams that include their school nurses on their teams in general. Now, the health center aspect is an interesting question. kind of tangential to this project, we've been really working on systems of care and meaningful community collaboration work, which has been happening as a little bit of a parallel process here. But as we evolve in that as well, that's another point of integration that we're working on with folks, which is because we also kind of related to that, we have an initiative in the state called Fostering Futures that really works on county and community agencies around trauma-informed care. So how do we bridge the gap between what's happening in the community setting, what's happening in the health setting, and what's happening within the school setting? And that is a place of evolution for us also, but a necessary place for good coordination of care.
Yeah, interesting. Because I know looking at trauma-informed practice in healthcare, whether it's school-based, school-linked, or just general, is a field that's really growing there too. It's probably doing some, complementary kinds of efforts.
Yeah, well,
Yeah,
and the goal is always to be like not supplanting and not duplicative and always cohesive, right? And always having that reciprocal back and forth. And it's that cohesion that becomes a sticking point, I think, because the two systems notoriously don't talk to each other or sometimes don't talk well to each other. So trying to figure out what that even talk looks like, right, as a foundation has been an ongoing project for us as an agency.
Well, I think you are modeling that today with both you and Mariah being together and this being a bit of a team issue here. And I do encourage our attendees, as you are looking forward to sort of exploring these ideas in your own world, that if you're in this education world, that you are reaching out to your public health colleagues, because we oftentimes have the connections that maybe can be helpful to you in doing some of that integration. And the health department with Mariah and her colleagues is a great place to start. And our National Center and all the resources that Leslie shared in the beginning are another areas to look. Are there any other questions? I think we're kind of wrapping here with the questions.
Good. So I love that it ends early. It's never happened in the history of any meeting I've ever had.
You were just so concise with what you were saying. Do you have anything you want to share before we end the webinar?
No, I just want to, thank you for the opportunity for, letting us share our story. And I agree the connection between health services and education is huge. And so I just appreciate being able to do that. And in fact, you talked about the resources over at Wisconsin DHS and that youth engagement toolkit I wrote down as you were talking, Ryan. I was like, I'm going to look that up as soon as I get off the webinar here. So anyway, I appreciate the connection and the collaboration. And, and like I said, feel free to reach out with questions or, concerns or comments, or just letting us know how your journey goes too. We always like to collect stories of things that are going well.
That's great. Well, thank you, Elizabeth and Mariah. And Leslie, I turn it back to you if you want to say some last notes.
Thanks so much for everybody's attention and attendance today. Thank you, Elizabeth. This was fantastic information to share. We will be sending out a recording of the session to everyone, and we'll have it posted on the State Adolescent Health Resource Center's website as well. So stay tuned for that information. And additionally, I'll just share that this is the final session that my regional office is putting on for this calendar year. And so we'll be packaging all, I believe, 15 webinars that we hosted this year focused on adolescent mental health and well-being, and we'll share that out through the listserv as well as with all of our partners on the call today to share with their contacts. So if any of the other sessions are of value of interest to your work, stay tuned for that in early 2019. Thanks, everyone.